we can end one shift and speak to patients and come in the next day, and those patients have still been waiting for us to get to them.
And it is really frustrating, you know, when you call people back, they've got young children that are really poorly, and we're just at the point where we just have to apologise.
The NHS is broken, and we are unfortunately the bookend that people get to, and we sit there and go, I don't know where we turn, unfortunately. So my name's Garrie Richardson. I'm a dispatch team leader in West EOC. I've been with the ambulance service now for just over 2.5 years.
I'm Ella, and I'm one of the EMA ATLs from West or EOC. I've worked for the ambulance service for nearly 6 years now.
So my name's Ashleigh. I'm one of the health advisors here at the 111 service. I've worked here for just over a year.
I love that it's different every shift. But also, I think the main reason is just the people you work with. I know especially down the EMA end, the staff just get on so well, and through recent times, it's just what has got each other, I think, through most of the demand pressures and like COVID, because it's all you've seen, it's all you see really is the staff here.
I love the ability to be part of a jigsaw that fits together for an end result. You can actually see the results you have on a day-to-day basis.
I love the team environment that we have here. We're all very close and just kind of doing our best for our patients. Something really great that's come from the pandemic is it's opened people's eyes up to what we do as a service, but in that respect it's now made us very, very busy. So sometimes we can't always do what we would like to be able to do for patients, and it's frustrating because it then gives us not necessarily a bad name, but it makes people distrust the service when they're not getting what they need from us.
The most frustrating thing for me is to see when we've got patients that call in continually. We've become a go-to service for everything, and people just have got to a point where they don't know where to turn, so everything gets passed on to us, and to the point where we've stretched ourselves so thin to try and tick all of the boxes, but we're missing sometimes the core values of what we actually are, which is an emergency service.
Yeah, the most challenging aspects recently has been the demand. It has been relentless for months now. We get a lot of abuse from the public, which is extremely difficult because it's not right. But it's managing then the staff dealing with that abuse, as well as having it yourself from speaking to the public. But yeah, it's not no one's fault in here that you can never get to a patient in a effective time frame, but you do feel responsible and you feel like you've let them down.
I think the biggest change, so when I first started, it was definitely like in the midst of the pandemic, like being at its worst, and patients were a lot more understanding. I think they were a lot more aware of the current situation that was going on in the world. They, if people were waiting a long time, they understood a little bit more and were a lot more, allowing of that. Whereas I feel like now people are a lot more frustrated because I think the public perception is that like the pandemic's over. So sometimes people don't understand why we're so busy, whereas before it was more understood, and I think that's the biggest difference, and just simply how busy we are. Like obviously we expected, as the pandemic started to like peter out a little bit, we thought things would start to calm down, but I actually think it's got busier, to be honest.
We're past the point, sadly, of a magic wand. It's that bad that I don't think there is a quick fix. There's nothing, but I think what not just SECAmb but the NHS and the government really need to go back to do is to really look at the people they've already got in their workforces already, So I think the magic wand would be, let's have a review of our education system, because actually there's hundreds of people that'd be fantastic at the role, but just because they can't sit an exam properly, they don't ever get the chance to do it, which is really sad.
If I had a magic wand, the one thing I would want to change for the benefit of like my colleagues and patients alike would just be for a better understanding of what we do as a service, what our capabilities are, and a kind of general consensus of what we do. Sometimes there's like misinformation, so a GP practice will say, oh, you can ring 111 and they can get you a prescription, whereas that's not necessarily the case.
I think the public need to be educated a little bit more, or need to realise that I think they're calling 999 because they're scared to go into hospitals, or they can't get a face-to-face appointment with their GP. I think it just has affected everyone, and then the 9s and the 1s are just getting the constant calls which aren't suited for us, but they feel like, I think the patients feel like they don't know where else to go or what to do, either because that they don't know, or they're too scared to go into a hospital or can't get through to their GP.